All right, everybody. I think we are currently at 12 o'clock, so we're going to go ahead and get started. Welcome to our PCOH end-of-year update. My name is Helen Hockey, and I have the honor of serving as the Executive Director for PCOH, and we are so happy you're here today and choosing to spend some time with us. We offer these brief updates on our coalition work twice a year, in June and in December. We want to ensure that all of you that have an interest in oral health in Pennsylvania know what we know. So as always, this meeting will be recorded and shared on our YouTube channel, so you can share the link with others after today. And just a little bit of housekeeping as we get started. You can type any questions that you have into the Q&A box, so you should have a little Q&A box on the bottom of your screen. And you can do that anytime during the presentation. We may be able to grab those questions as they come in, but if not, we'll have a little bit of time at the end to make sure we get through them. For anybody who's joining by phone, if you're unable to see the slides right now, please, I encourage you to go back and review them at a later time. We will send the link for the presentation out directly to everyone who registered for today. And then we'll also send the slides by themselves as a PDF document. So there's a lot of integrated active links that are built into the slides. With just an hour to talk with everybody, we don't have enough time to share everything. So we want to make sure that you can click on those active links at a later time to learn more about anything that you're interested in. So with that, we're going to go ahead and get started today. I wanted to kind of kick off our webinar and invite our board chair, Dr. Joan Gletch, to say a few words of welcome to everyone. Dr. Gletch.
Thank you, Helen. Welcome, everyone, to our end of the year Pennsylvania Coalition for Oral Health webinar. This webinar you'll find very interesting as Helen and staff are summarizing many of the key activities that were so important to improve access to oral health care that's so important for us as stakeholders in the Pennsylvania Coalition. Now, although we look at troubling times, we look at difficult times, Pennsylvania Coalition for Oral Health is a beacon of light. We promote oral health, we stand strong, and thank you for joining us. And we look forward to hearing all the wonderful activities and have you join us. So if you're interested, if something piques your interest, let me or Helen know. We have wonderful committees that work year-round. For those of you who attended our summit, wasn't that great? And I think that there's continued opportunities to join and work with us. Thanks so much, Helen, for this developing this program, and I'm going to send it back to you.
All right. Thank you so much, Dr. Gletch. It's really been an honor. You've been able to serve as our board chair for the last 2 years, and as we kind of wrap that time period up, I know that we're still going to benefit from the wealth of your knowledge as you continue to serve on the board. So thank you so much. It's been wonderful.
Thank you. Thank you, Helen.
And I did also want to mention we have 2 very special board members that have expiring terms this month in December. So Dr. Mike Mermigas and Dr. Joe Mountain are going to both be stepping down from the board. Their service over the last 6 years has just been completely invaluable to the work we do, and we're going to miss their expertise on the board. But I have a feeling we're still going to see them around a bit. So we're also really fortunate to be bringing on 3 new board members starting in January. And those are some folks with a breadth of expertise that's going to really help us grow. So Kimberly Burry, Dr. Janine Burkhart, and Jenny Salisbury are all going to join our board in January. So we hope that you get the chance to work with them if you haven't already. So thanks again to our board and all of the work that they do to ensure we are successful in all of our work. So I do want to just point out our staff members here at PCOH. These are the folks working behind the scenes to ensure all of our projects and programs run smoothly. Amy manages our operations and communications work, as well as works in donor management engagement. Nicole works in our policy and advocacy spaces and helps with our water fluoridation and Medicaid task forces. Leah coordinates many of our programs and ensures that we're compliant with evaluation requirements, along with managing our school sealant program and community health worker collaborations. And then last but certainly not least, our newest staff member, Nora, is joining us to manage our dental access coordination work across the state. So we're going to talk a little more about that later. But I did just want to, say that I can't thank these individuals enough for the work they put in every single day that ensures our success. So thank you guys, and wanted to make sure everyone kind of knows who to go to for different concerns or ideas that you might have in oral health work in Pennsylvania. So for anyone who's new to the coalition, we're going to be sharing some of our projects today that we've worked on in 2025. Definitely not inclusive of everything that we've done. So if you're wondering, well, what about this or what about that? Definitely reach out and we can share information. There might be some things that kind of collaborate and work with the things that you're doing. And we want to make sure that we can share that information with you. So our main priorities remain on workforce policy, water fluoridation, and underserved populations. Those are kind of the key tenets of what we do, and we're going to talk a lot about those things today. So just wanted to share those key priorities for anyone that might be new to the coalition. And before we get started, of course, I need to take a moment to acknowledge the incredible support that we receive, from so many different funders. Every year, we've got dozens of partners that continue to support the work we do, and that helps us to expand our reach. Beyond our corporate and our foundation partners, we've also got individual donors and organizational donors that help to sustain our mission. So as a nonprofit, of course, we receive a number of grants and apply for grants for projects that we complete, but the support that we get from all of these funders is really what keeps the lights on. So your contributions that everyone, so many of you on this call even, have made are not just financial. For us, we really just consider them a testament to the shared commitment that we all have for Pennsylvania and Pennsylvania oral health. So thank you, thank you, thank you, thank you, thank you, and thank you. It's amazing to see so many people support the work that I love to do. So today, we're going to touch on a couple of the areas that we've worked on in 2025. I would bet most of you would agree that fluoride has been a pretty hot topic this year. That seems to be really one of the top ones that's kind of come out of the news and the headlines and the media. So we wanted to share a little bit about the work we've done in that space. So as we look back on 2025, our focus on fluoridation work really has just remained crucial. We've been actively supporting local communities to maintain water fluoridation. So for those who may not know, we have about 200 water systems in Pennsylvania that adjust their fluoride levels to the best level we need for dental health. And that supports about 60% of Pennsylvanians who get their water from a public water system getting optimally fluoridated water. But every year, there always seems to be a handful of communities that want to reconsider that decision. So far in 2025, we've had 8 communities in Pennsylvania that have considered a rollback to their fluoridation program. And, that's pretty typical. That's about what we see every year. Sometimes it's as few as 3 or 4. Those are good years. And we've seen it even higher than 8. So I am pleased to share that this year we've successfully defeated rollback attempts in 3 separate areas. So Clearfield, Somerset, and Red Lion. These were all communities that were considering ceasing their fluoridation program. And these successes were only possible because we were able to work with local community members and healthcare providers. So we were able to educate water boards on the importance of oral health and fluoridated water, and they decided to maintain their program. So thank you to those communities, and thank you to those who helped support that work, as we provided testimony and resources and met with folks. It was really, really important. We did have 2 communities, unfortunately, Edgeworth and Tyrone, that did vote to cease fluoridation. Both of those communities, we were not able to, get in early enough to provide more information. And so sometimes that happens, that votes take place and we don't hear about it. So our work is continuing right now. We have three current challenges in Sunbury, Selinsgrove, and Fleetwood Borough out in Berks County. So if anyone on the call today is from one of those three areas, please let us know if you're willing to help us protect fluoride, and we can help you with communications and testimony and working together with the communities to keep it. But all in all, for three of the five that have been decided to be, successfully defeated, we're really, really excited about that. That says a lot for the knowledge base that's out there now and how important we realize that fluoridation is. So the other side of what we do in the fluoridation work, I'm sure many of you have seen the national headlines on fluoride bans and, fluoride research and all of these different things that have been coming up. It doesn't really appear that a national ban is going to be coming anytime soon, despite the words that we hear sometimes. But we have seen a few states pick up on that rhetoric. And two states in particular, you've probably heard about, Florida and Utah, both had statewide bans issued through legislation in the last year. So that's something that we watch really closely. In Pennsylvania, we had two bills introduced, House Bill 1660 and Senate Bill 849, that would essentially ban fluoride in public water systems. So those bills were introduced early in the year. They were sent to committees, and that's kind of what bills do in Pennsylvania. We send them to a committee, and then the committee chair decides if they're going to put them on a calendar for a vote. So right now, there doesn't appear to be any interest in our committee chairs to put these on a vote. So we're monitoring them, but we don't anticipate they're going to make any traction. So, if you hear folks talking about a state ban in Pennsylvania, there are thousands of bills introduced in our state legislature every year, and only a few hundred of them actually pass and become law. So it only takes one person to introduce a bill, and it takes a few hundred to pass it. So we're not too worried. So I just want to share that with you all in case you're hearing anything. We also, in order to counter some misinformation and highlight some of fluoride's benefits, we've issued 3 press releases this year, all focused on the benefits of fluoridated water and the science behind it. Because as we know, there is absolutely, no harm ever shown in any study ever at the levels we use in water fluoridation for people and their health. In fact, there's only benefit. So we want to make sure that folks are aware of that. We're also proud to report that through issuing equipment grants to water systems, we've also secured continued fluoride access for 31,000 residents in Pennsylvania. So those are water systems currently fluoridating that we're working with to make sure they keep doing it. And we will continue to offer our free education course for water operators on our website. So that reinforces the importance of the water operator role in maintaining safe and healthy water systems. So those are just a few of the things we've worked on in 2025 for fluoride. As we look ahead to 2026, our efforts are really going to be focused on monitoring and advocating for fluoridation. So we're going to watch those bills that I mentioned. Of course, that legislation would have the potential to impact public health significantly. So we want to stay as proactive as possible and continue those conversations with the committees. We'll also continue to attend water operator conferences. So if you've never been to a water operator conference, they're kind of fun. I don't know if they're for everybody, but I enjoy them. We love to go and talk with the water operators and hear about the day-to-day work that they go through, making sure that water is safe and high quality. And we love tap water, right? We want to encourage people to drink tap water. So the water operators like us because we love tap water. And so attending these conferences is really essential for keeping our network strong and making sure we can share best practices directly with municipal decision makers. Additionally, we're going to continue our water equipment grants. So those are funded through the CDC, and we want to make sure that those grants continue to be out there to maintain and enhance community fluoridation efforts. If you know of any systems that are reconsidering their fluoridation status, right, we want to know about that. That's one of the sort of biggest things that we do in the fluoride space is working directly with water systems, towns, bureaus, municipalities. So if you hear any rumors or you see information in your local areas around water systems that are considering removal of fluoride, please let us know right away. We have a state water action team that does coordinated action and advocacy. So if we hear about something, we kind of have this whole process that we roll out to make sure we get champions in the community to be able to go out and talk about fluoride. So, and if you want to receive regular updates, from our water fluoridation task force, and then possibly assist if a rollback threat is in your area, you can join us in this effort, and you can click on the link when you get the slides and sign up to learn more. So together, these are all the kind of initiatives in water fluoridation that we want to make sure we're continuing to use to promote oral health. So next, I do want to focus our attention on the oral health workforce. It's definitely another topic that's been top of mind for so many, not just in Pennsylvania, but in the country. So one of the things that our coalition does, is we do work with a number of other state coalitions, and all I'm hearing from everybody is workforce, 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 workforce. So, it's something that we know, we have to have workforce to have access. And so we continue to keep that sort of as a top priority and focus a lot of our energy there. So in 2025, we were able to hold multiple webinars in our Workforce Hot Topic series. So that's a webinar series that looks at discussions around oral health workforce issues. So licensure, portability, loan repayment, and training access, right? So we have to make sure we're training enough providers, we're making sure that they can afford to work, and we're looking at sort of where they can work in the state. And we're going to share a little bit of information later on the next webinar, which we're going to host in January. We were also really excited to have Pennsylvania be a part of the ADA Medicaid pilot project, which, was a project we partnered over 2 years with 5 other states, focused on increasing dental provider participation in Medicaid. So our goal with that project was to identify ways that we could increase provider networks, which then in turn increases patient visits. We talk about workforce and access hand in hand. So in order to get people to access dental care, you have to have a workforce that's ready to treat them first. So for us, workforce is really the first step in increasing dental access. So we need to have enough providers out there working. And so, the Pennsylvania Department of Human Services was the lead on this project. And we were very successful in sort of engaging with the dental managed care organizations and seeing a bit of an increase, in what we would call meaningful Medicaid dental providers. So the folks that are out there actually treating patients. So in addition to looking at some of the dentist numbers available, we also have to make sure that we have enough dental assistants in the workforce so they can support the dentist to help them see more patients. So our dental assistant radiology training program, which we call DART, offers virtual instruction on skills needed to pass the DNB RHS exam, which is what's required in Pennsylvania for dental assistants to take x-rays. So that was a need that was identified through a community of practice group that we work with, that we realized many dental assistants weren't sort of getting the background knowledge to pass that exam, which kind of left them not able to do their jobs very well. So we developed this program. It's been pretty popular. We've had a few iterations already in 2025, and we've been able to successfully get dental assistants to pass that exam. And then lastly, I wanted to mention our collaboration with 3 other states on a dental assisting environmental scan. So we've been working with West Virginia, North Carolina, and Ohio on a shared project. And what we were able to do in Pennsylvania was identify 15 high-need counties that we could start with to improve dental assistance. So that 4-state partnership has actually, we just submitted a pre-application to the Appalachian Regional Commission ARISE program. So if that is approved in 2026, we would be invited to submit a full application that would give us a 5-year grant focused entirely on improving dental assisting workforce numbers. So we're really, really excited about that. And a big thank you and shout out to our workforce consultant, Paulette Dietz, who has led that work. We know that it's not just about the dentists. We also have to build up all the other aspects of the dental workforce. So, these efforts are really sort of just continuing that commitment to building that strong workforce. Now, I do want to mention, this is a slide that we developed and we've shared in quite a few spaces, so maybe some of you have already seen it. But we wanted to kind of look at the current landscape of the workforce and, compare that to what we would ideally aim for. So if we look at our practicing dentists, we have 6,240 full-time dentists or full-time equivalent dentists in the state that are actually practicing, providing patient care. Now, some of you have probably heard a lot of other numbers. We actually have 9,000 licensed dentists in Pennsylvania, but many of those live out of state or they don't practice. So when we actually look at the numbers practicing, we're at 6,240. So if we want to hit the suggested goal of 60 dentists per 100,000 people, in Pennsylvania, we would need to have 7,800 dentists. So that's a pretty significant difference. It kind of shows a gap that we've got to bridge to meet the demand. If we move on to hygienists, our dental hygienists, who are, our preventive specialists in the dental office, we definitely see a need for more hands on deck there. We currently have 7,700 practicing in Pennsylvania, which is fairly close to a 1-to-1 ratio of hygienists to dentists. For those of you in clinical care, you know that an office is most productive with 1.5 to 2 hygienists per dentist. So we definitely need a few thousand more to meet those goals. So looking at both dentists and hygienists, we're only graduating around 300 a year in the state for each profession. And the numbers retiring annually are more than that. So we're losing them when we need to add them. And then lastly, we look at our Medicaid dentists, because when we think about the fact that we've got 3 million Pennsylvanians who are served by Medicaid, and right now we have a little under 2,000 providers that are actually seeing Medicaid members and billing to Medicaid. Most dentists that accept Medicaid, would normally say that they want no more than 20% of their payer ratio to be Medicaid, because they've also got to see patients who have commercial insurance or Medicare, or some who just pay cash for their care, right? We have uninsured patients or those who choose to pay cash for their dental care. So if we look at the numbers, and we've got 3 million Pennsylvanians enrolled in Medicaid, and we think about that ideal 60 per 100,000 dentist to patient ratio, and we also consider the fact that a dentist may only want a 20% Medicaid ratio of their insurance practices, we need around 9,000 Medicaid dentists to meet the need of those 3 million people. So as you can see, we've got some pretty significant disparities, and what we're trying to do is look at programs that will start to close those gaps and move us closer to an ideal workforce. So what we're going to do in 2026, we want to continue working on our workforce deliverables, try to make a dent in some of these disparities. So first, I did want to mention, I'm sure many of you have heard about the Federal Rural Health Transformation Program, which is a 5-year funding cycle that's going to be awarded to states across the United States. It's all through the federal government. Each state was able to submit their own application, and those applications are currently being considered at the federal level. So our plan asked for $200 million annually to work on rural health, and included not just dental workforce improvements as an objective, but it also listed PCOH as a key stakeholder in the work. So we're grateful for that. We're really hopeful that we're going to be able to assist the Pennsylvania Department of Human Services as they move forward with this program. They're expecting decisions from the federal government on the awards for each state by the end of this month. So, in the next month or two, we're going to know a lot more about what that's going to look like. But just, very excited and encouraged to see that dental workforce was included as part of the plan. We're also going to continue, maintaining our Hot Topic webinar series, which we've been able to share and kind of get more people engaged in some of the workforce issues that are out there. And then we'll continue our Speakers Bureau. So if you're not familiar, we maintain a Speakers Bureau where we ask current dental providers who are willing to educate high school students and really inspire kind of that next generation of healthcare workforce. And we can kind of help provide resources in that. If you're interested in participating, we really do, we put it in red so that, you see it's something that you can help with. We really do invite you to fill out the interest form. So all resources, materials, connections with schools can be provided for those who want to help. And, that's kind of it's a goal of ours to be able to distribute that information around the state. I think we have, I'm going to kind of spitball this off the top of my head. I think it's somewhere between 800 to 1,000 high schools in the state. So if you think about that and how hard it would be to go in and speak at every single career day, we really would love a little bit of help from those of you who are interested. So education really does remain a cornerstone of this work. So, we're going to keep talking to high schools and students and guidance counselors. We're going to also keep talking to current dental school students and dental hygiene school students to make sure they understand, the benefits and the goals of public health and why it's so important. And then we've also committed to helping our Pennsylvania Department of Health Oral Health Program with their CDC grant that has a focus on infection control practices in dental offices. So again, that's education and training for the dental workforce. And then finally, we are, continue to be committed to providing resources for other members of the workforce, like community health workers, school nurses, medical providers, anyone that can possibly start distributing that information about oral health and how important it is to get overall health. So those are sort of some of the initiatives we're going to be working for in the workforce space. Another area where we focus is in the policy and advocacy space. So we do publish an annual policy agenda that's on our website. And so through that work, we're trying to make change at a systems level that improves oral health for all Pennsylvanians. And sometimes policy is like law and legal stuff, and sometimes it's other things. Sometimes it's, small little areas where we can encourage people to add oral health to current programming and just adapt that into their policies that they already have at an organizational level. So, even though we talk a lot about legislative work, I do want to share that, oral health policy can be a variety of different things. I do, want to dive into some of these key areas that we worked at in 2025. For those who may not be aware, back in 2011, Pennsylvania changed its dental coverage for adults under Medicaid. So some of our more comprehensive benefits were made, more restrictive, and PCOH wants to see those benefits revert back to our 2011 protocols. So that would be a way that we could get better dental treatment for about 1.5 million adults that rely on Medicaid. And it would also benefit the nearly 2,000 dentists that work in that program, right? So they would, currently they're not really able to provide quality treatment to their patients because of those restrictions. So to that end, PCOH has worked with different legislators over the last few years, and we currently have 2 bills in the House and Senate that would restore the dental coverage for medical assistants back to those 2011 levels. So our House bill passed through the full House in June with bipartisan support. So now it's in the Senate, and, we're hoping to get the Senate to do the same. So in the meantime, while we're waiting for laws to change, because that takes a little while sometimes, we're also working on clarifying the benefit limit exception process, which is known as the BLE. So this was the extra administrative process that was enacted in 2011, and just sort of makes it more burdensome to get some of those more comprehensive benefits approved. So recent recommendations and a lot of support from the Department of Human Services and our Medicaid managed care organizations have now really kind of opened up that approval process for these exceptions. So, if that's something of interest to you and you want to learn more about it, please reach out. We want to make sure everyone is aware of those, we'll say lessening of restrictions, because that means more people are going to access comprehensive dental care. And PCOH was also invited to provide testimony earlier this year at a special hearing for the policy committee that was dedicated to rural dental care shortages. So that's led to a lot of continued conversations. So we were able to present information and data and share, and, really with a lot of partners, right? Many of you that are on the call. And that's kind of added to this continued conversation we keep having now with legislators and communities, so that, everybody's getting interested in dental care. And we have a few of the bills listed here that are sort of impacting dental care in the state. But I want to say, I think we're sitting at like 20 current bills right now that involve dental care in our state legislature, which is a lot. So I definitely think we're getting more and more interest from those decision makers on how important oral health is. So, we're looking at the one dental workforce bill that I listed here. We've got this House Bill 1127 and Senate Bill 81, which would actually establish an interstate licensure compact for dentists and dental hygienists, which would make it much easier for professionals to practice across state lines, which we hope would help shortages, right? Because if you live 20 minutes from a border, there's no reason that you can't practice your same profession, when you drive 20 minutes away. Initially those bills were established to help military families, but they're finding that there's a lot of, kind of unintended benefits there that when we start opening up those licensures across state lines. And then the last bill I did want to specifically point out today was House Bill 157, which is a rural healthcare grant program that would increase loan repayment options, scholarship options for providers. So earlier in 2025, we were able to suggest amendments to this bill that added dentists and dental hygienists to the list of providers that could apply for the funding. So of course, that's really, really important in that rural workforce space. So what we're going to continue working on in Pennsylvania, if you're not aware, we run a 2-year legislative session. So we started in January of 25 and it runs till the end of 2026. So we have all of 2026 to keep working and making progress on all this. So, we're going to do that. We're also going to continue some work that we just started alongside the Department of Human Services Medical Assistance Program. We started a new Medicaid collaborative through the Center for Healthcare Strategies, and we're going to be working with some other states and learning about some of the challenges and successes they've had to improve our own Medicaid program. We're also gearing up for another Oral Health Advocacy Day in Harrisburg. So some of you have joined us in the past at some of those events. It's a great opportunity to make your voices heard directly to the legislators and their staff. So if anyone on today's call is interested in learning more about joining us in Harrisburg in March, please fill out the interest form and we will get right back to you. We will be submitting, as usual, I think we do this every year, but we're going to submit formal requests to the governor and budget secretary and Department of Human Services to make sure that we try to, increase our spending and efforts in the budget for oral health, which includes the restoration of the Medicaid funding for dental care. And then finally, we're in the middle of a project where we are assessing minor changes, and administrative changes that could be made in the Medicaid program to help providers and patients. So we hear a lot from both ends that, sometimes it's just too many phone calls or too many steps or too many clicks. And how can we streamline this process to make sure that patients understand their benefits, get their benefits, find a provider, get approvals for the services they need, all of those things. And also help the managed care organizations build up adequate provider networks. So we are working with a consultant on that and expect to publish a formal report that's going to be shared with the Department of Human Services, hopefully by the middle of 2026. The idea is that we're going to have some really well thought out recommendations that improve the administration of the Medicaid program and really support providers and patients. So the last major focus area I want to talk about today is our outreach and events that we hold and attend. We want to make oral health advocates out of everybody. So we accomplish that by sharing materials and presentations and all kinds of different things. So maybe some of you have seen us at various events throughout the year. We spend a lot of time thinking about our partnerships and where we're most needed to share information. So as you can see, we were able to exhibit and present at 55 events in 2025, which is insane. And that allowed us to personally connect with almost 10,000 people across the Commonwealth. So very, very cool. It's one of my favorite things to do. All of our staff pitch in, and you can see some of the pictures there. Even some of our board members pitch in. And, you know, we kind of consider these outreach efforts, you know, crucial in spreading awareness, educating communities, and developing new connections, right? So across the various sectors. It's not just, you know, going to dental conferences. It's also, you know, high school career events and water operator conferences, different places where you wouldn't expect to find the dental people. And even at the water meetings, they call us the toothbrush people because we show up and we hand out toothbrushes to the water operators. And they love it. So, you know, it's a great way for us to be able to engage with them, talk directly to the people who are making changes in their communities. Another program in our outreach space that I wanted to share today was the incredible work of our state-supported school sealant programs. So during the 24-25 school year, you know, we have some funding that's awarded through the Pennsylvania Department of Health Oral Health Program, and we're able to work with 9 different programs across the state and collect data from their direct care programs. So they go out to the schools and they're able to give kids sealants, dental sealants, to protect their teeth from cavities. And so just in the last school year, those programs were able to provide more than 8,000 sealants to over 1,700 kids in 101 schools in the Commonwealth. So those numbers are pretty impressive, but I want to point out that they really do represent more than just statistics. They really reflect healthier futures for kids, right? Because kids who have cavities, they don't sleep, they don't learn, they can't concentrate. And so if we can just eliminate some of those cavities and some of the pain that kids face, we're going to impact their daily learning, which then changes their whole life. So if any of the dental providers on today's call are part of a federally qualified health center or a school health provider or county or municipal health department, and you want to learn more about how you can be part of this program, please reach out. Our long-term goal, which I think we're really doing well with, is to reach 122 schools by 2030. My hope is that we could possibly do it this year. So we'll see. It would be great to meet that goal. It was a 10-year goal, and so it would be wonderful to meet that goal a few years early. I will gladly bump that goal up. So if that's of interest to you and you have a way to help us in that work, please let us know. And the next initiative I wanted to highlight was our participation in the Building State Capacity for Integration, or BSCI Learning Collaborative. So this initiative focused on dental care for the maternity population, and it's really allowed us to learn from other states. So, you know, at the same time that we're trying to roll out new programs and meet the needs in Pennsylvania, we're also working with other states to kind of learn from them. So, you know, the team includes the Bureau of Family Health and the Oral Health Program at the Pennsylvania Department of Health and the Pennsylvania Department of Human Services. So over the last 12 months, we've worked with and learned from efforts in Idaho, Michigan, Rhode Island, and West Virginia. And we've got about 4 months left on the project. So we've got some state-specific goals that we're focused on sharing resources and educating maternity care providers on oral health. Another factor that we're looking at, another goal, is that we want to secure Pennsylvania's participation in a national program called the 100 Million Mouths Campaign. And that emphasizes integrating oral health into medical curricula. So it's a significant step in ensuring oral health is a standard part of all prenatal care. So how are we accomplishing that? We've started by sharing a maternity care resource packet. So this is something that folks can request. You know, if you work in this space or you know of any maternity care providers out there, you know, we send a whole gamut of different flyers and brochures, things that are meant for providers, but also for patients. So handouts that they can give directly to patients that talk about maintaining oral health during pregnancy and beyond. So definitely reach out. We'll get you a free packet if that's a space you work in. And we were also successful in recruiting at least 2 physicians to apply for that 100 Million Mouths campaign, since Pennsylvania was chosen to be added to that for 2026. So we look forward to the selection being made, hopefully in the next couple months, so that we can start doing more integration into oral health or medical curricula of oral health. And one of the last sort of 2025 outreach things I wanted to talk about was our summit. Dr. Gletch alluded to this earlier. In November, just last month, we hosted our 5th Pennsylvania Oral Health Summit. This one was focused on transforming systems to strengthen smiles. And we were really pleased to have nearly 140 attendees joining us. We host this event every 2 years, and we had 24 presenters over 2 full days, which was a lot. Lots of good panels, lots of good Q&A, lots of good information. And it really was just a great opportunity for learning and networking. For those who weren't able to attend, or for those who did, but really want to revisit any of those presentations or share them with your colleagues, you'll be really pleased to know that our photos, our outcomes report, our recordings, all of the follow-up from the summit is going to be available on our website in the next week or so. So watch your inboxes. We're going to have a special Summit Edition newsletter that's going to be coming out to share that information with everybody. It was truly, I want to say it was just a truly amazing and humbling event this year. So grateful to all of those that were involved. Our staff worked really hard to make it a great event. We received so much support from our funders so that we could, do everything we wanted to do. And the presenters and exhibitors, they brought their A game. Like it was just a wonderful event, if we don't say so ourselves. And kind of looking towards 2027, I think it's going to be pretty hard to beat. So we do have dates, and those are shared on our website as well already. So if this sounds like something you want to be a part of in 2027, we do already have our dates for that. And we actually have 2029 dates as well. So you can plan out your next 5 years to come and hang out with us. So looking ahead for outreach in 2026, we do want to keep expanding our efforts. Sometimes I wonder if we can keep expanding. I did mention earlier that we have just added a new team member, Nora, who's going to be focusing on statewide dental access coordination. We want to ensure that dental services are as accessible as they can be in light of all the current problems we're facing, to everyone in our community. So we get a lot of requests, sometimes daily, from people and organizations that are just seeking help in providing and finding dental care. So we want to really focus on that in 2026 to make that as easy as possible for folks. We're also really excited to introduce some new toolkits for community organizations and providers that will help educate patients on sugar-sweetened beverages and acid content in beverages. So we developed these resources in 2025 through a special project with the Department of Health Oral Health Program, and now we want to make them more accessible to more groups. So, stay tuned for that. We're going to be kind of coming out with some of those materials. And in addition to those new initiatives, we're going to continue our efforts in exhibiting and presenting at partner events. I think we went through them, yesterday. I think we have 30 events on the calendar already for 2026. So really excited to see where we can go and who we can meet and talk with this year. And then we'll continue to distribute all of our materials through our website, keep everybody informed. We have a weekly newsletter. We have daily social media posts. So if you want to know about public health and dentistry in Pennsylvania, we can definitely keep you posted. And of course, we're going to remain committed to our programs like the school sealant programs, collecting data to share on those things and make sure that we're getting preventive dental care for kids. So all of this is sort of, steps in our mission that we can enhance oral health across the state. If any of our stakeholders out there, if any of you have more ideas for resources, we have people all the time that say, well, I'd love to have this. And we say, hey, we should make that. And sometimes we can. We're trying to always grow our library depending on the needs that we hear about. So definitely reach out if there are things that you're missing in your oral health resources. So as we wrap up today's webinar, I wanted to highlight some of our ongoing resources for anyone who's new to PCOH and you may not be aware of what we offer on our website. Over the last few years, it's definitely become apparent that finding a dental provider is one of the greatest needs for patients. For the patients and then for the organizations that assist in those efforts as well. There are so many places that you can find information. We've got United Way's 211 program and Find Help and the State Dental Association and Safety Net Clinic websites and free clinic websites. But our goal is that we want to have a one-stop shop, a compilation of all these options in one place. So we've created a flyer, we have a website page, all dedicated to finding dental care. So we consider this as an essential resource for individuals and groups that are looking for all of their options in one place. So it doesn't mean that you're going to find a list of 34 names, for your county, but it means that you're going to know where to look to get those names. That's our goal. Hopefully we can build that out and do even more in the coming years, but for now it's sort of the first stop in what we're trying to accomplish. So if you know of any resources we can add or you see things that are missing, please let us know. Next, we also host a clearinghouse on our website called the Request Materials page, which offers a wealth of information. It's kind of like a shop for oral health resources. So we provide all of these resources free of charge. We ship them directly to you. So if you're going to attend a community event and you'd love a couple posters on sugar-sweetened beverages, we can do that. Those are the things that we love to be able to kind of get. Our goal is to see all of these materials used in as many communities as possible. One of my favorite things is when, a stakeholder sends us a picture of their dental office and they have one of our materials or posters up on the wall. It's just great to know that those things are being used and helping to educate everybody. And then lastly, we do provide free self-paced learning courses. So webinars, online webinars, all to enhance knowledge, allowing you to learn at your own pace. If you're looking for online webinars, I think we're up to about a dozen courses available on the site, and quite a few of those are approved for dental continuing education credits as well, all free of charge. So these are sort of what we see. All of these resources are kind of pivotal in supporting our mission to improve oral health. And so if there is anything on there that you have questions about or you want to use as much as you want, that is wonderful. That's what it's there for. And then for my last couple slides, I wanted to highlight some of the newer resources too. If you haven't stopped by the website in a while, we focused a lot on healthy diet this year. So we created two very special rack card style pieces. So like the skinny rack cards. One was focused on packing a healthy lunch for kids. The other was highlighting the importance of looking at the pH of drinks and the acid level, not just the sugar content. So, when we go around and we talk to folks, we say, hey, did you know that purified waters can be just as acidic as black coffee? So people are always shocked to know that Aquafina can actually cause cavities. So some really cool things that have really engaged the stakeholders. So hopefully you're able to share those as well. And then lastly, with the help of a consultant, Dr. Karina Culler, PCOH was able to finish a project and publish a very detailed report this year on school dental services. So I would encourage you guys to check it out, see some of the information that we learned from talking to school nurses and surveying what they do about the dental needs in schools. And then the last resource I wanted to share is some materials that were developed by partners, right, or friends of PCOH. I mentioned earlier the PA Rural Health Transformation Plan. This is a copy of the application, so if anyone wants to learn more about what the state's looking at and what they've put in as their ideas for the program and the funding, that is linked for you, so you can check it out. And then next, our State Department of Health Oral Health Program was also able to publish a wonderfully thorough oral health workforce pipeline plan. So it's a strategy report that really highlights dental careers, talks about the pipeline, how we're going to build future professionals. And I think it's kind of a great roadmap for us. So we're going to continue to look to that, and I hope everybody else does as well. And then lastly, we were also able to work again with the Pennsylvania Department of Health Oral Health Program to develop an emergency preparedness and response manual. So that's specific for Pennsylvania's oral health workforce. thinking about what we went through in 2020 and some of the things that happen in a situation like a pandemic, we want to make sure that our dental professionals are prepared in Pennsylvania for any situation that could be coming. So these are just sort of some resources that we consider stepping stones, towards how we're going to get to a healthier Pennsylvania. So I hope you guys will check them out and engage with those initiatives as we move forward. And then lastly, I mentioned our Workforce Hot Topic webinar series earlier. I wanted to share some registration info, and we'll send this, of course, out with after to everybody who's registered as well. Our session coming up in January is going to feature Paulette Dietz, who's one of our PCOH workforce consultants, who's going to provide some background on dental assistants in Pennsylvania. And it will also feature Hannah Aronovich from the Dental Assisting National Board, or DANB, who's going to share some pretty cool up-and-coming information on a new dental assisting professional model. So if dental assisting is your jam, definitely register for the webinar. It is free and will be hosted on January 23rd. And then we also have the link there for the next round of our DART program. Again, that's the program that helps dental assistants learn more about radiology skills so they can pass their RHS exam and be authorized to take x-rays in Pennsylvania. So if any of our clinical stakeholders out there can use this information, share it with assistants in your office. It's a really great program. And I took the liberty of also adding the dates for our 2026 update webinars. So, we do these fast and furious webinars twice a year. So they're already on the calendar. I hope you add them to yours, and then you can come and see what we've been up to, both in June and December of 2026. So with that, that's the end of our slides for now. I want to turn over to our Q&A and see where we're at there, to make sure that if you guys have any questions, you can type them in the Q&A box and we can answer those. Let's see. So we've got a question about any movement towards legally allowing school nurses to perform oral health screenings. I would say that, in the last 18 months, we were able to make some progress and have Act 55 pass in 2024, which does allow our public health dental hygiene practitioners to do the school screenings in schools that don't have a school hygienist. That's a good first step. We are hopeful that we'll start to see, basically all of the different ways we can allow those screenings to open up and oral health services. So I would point you back to the resource document that we shared, our report on school dental services. There are some recommendations in there that we're going to be putting into some policy agendas and legislative agendas in the coming year or two. So that could be part of it. Really, it would be lovely, and I say this all the time, so apologies to those who've heard me talk about this. I would love to see a dental hygienist, a certified school dental hygienist in every single school district. That would be ideal. We would love that. But it's very expensive to do that, and a lot of schools are not necessarily kind of going in that direction. So with that, it's one of those, if we could figure out a way for those positions to be funded, it would be a lot easier to get school hygienists in the schools. And so one of the pieces from our report found that if we could get schools to be able to be registered as Medicaid providers and bill Medicaid for those services, all of a sudden, having a dental hygienist in the school district could be a sustainable position. And so, that's one solution. Another solution is opening up the people that can do the dental screenings. That's going to require some law change, and it's tricky with schools, as some of you know, because typically a law change for school services requires a change in the school code as well as the Department of Health code, because our schools' health programs are governed by both. So it gets very, very tricky, definitely a multi-step process, but something we're not giving up on yet. So just, we're working on it. So keep pushing us, make sure, any ways that we can help support that work. We want to make sure we're getting as many health services into the schools as possible. And I would also point out that we have school-based health centers in a few districts in our state where health services are allowed to be done right in the schools. And those are great options that we'd like to see an increase in as well. So something to think about, you know, if you're on a school board or you work in a federally qualified health center that works with school districts, opening up a school-based health center is another great way to get dental services into schools. So we're not just doing screenings, we're actually doing care as well. All right, any other questions, guys? I'm not seeing any others come in. Thank you, Lisa Davis and the Pennsylvania Office of Rural Health for your wonderful comments there and your compliments. We appreciate it. We work with so many great partners. It's incredible just the sheer volume of people that care about oral health. And we're really fortunate that we've got some wonderful partners in more agencies and organizations than I could possibly name, even in a 3-hour webinar across the state. So thank you to everyone who continues to be engaged in our work and support our work. We just honestly cannot do it without you. It's been a great year, and we're just so happy to have all of our stakeholders here listening. You know, there's nearly 1,200 of you across the state now. So we're just very, very glad to be able to do this work. And from myself personally, thank you so much for allowing me to do this work, because it's wonderful. So with no other questions, I would say we're going to call that a wrap for 2025. Wish everybody the best holiday season, and I hope that you all have so much free time and relaxing time with family and friends, because you deserve it. And we will see you in 2026. All right, thanks everybody.